All right, can you all see the presentation? Yep. Okay. Well, thanks for joining us, everyone. So if you are unfamiliar with this group that you signed up their event for, Society for Health Systems, we're like a subgroup of IISE, and we focus on healthcare and health systems and clinics, and specifically systems engineering and analysis and process improvement methods in those groups. Within the group, there's opportunities for students, including scholarships and networking and free webinars, which if you've been following the IISE page or the SHS page, you know there were quite a few going on this summer. And we have a conference every year in February, which this year is going to be virtual and in person, probably. And we have a discounted membership for students. So if you're already an IISE member, it's only a few extra dollars to also be an SHS member. And something we're trying to get going is a student LinkedIn page. So if you guys want to join, you can scan this QR code, or the link is in the chat if you can see it. But the goal of the LinkedIn page is to connect students between conferences, and we'll try to post internship and job opportunities when we see them, and also help teach all our members more about health systems engineering, because we know some industrial engineering programs don't cover the health side a lot. So yeah, as you can see, my name's Taylor, and I'm the president of the student board, which is putting this on tonight. We have a couple other members of the student board on here, like Christopher and Matthew and Rachel. And yeah, we're glad to put this on for you today. So don't forget to join the LinkedIn page when you get a chance. Let's see. So our agenda today, we're just going to do panel introductions real quick, and then we're going to have some prepared Q&A, and then we're going to take questions from you guys, and we're going to use Pigeonhole to try to do that. So if you use this QR code or this link that's also in the chat, you can go on that Pigeonhole, and that'll let you submit questions anonymously, and you can vote your favorite. So go ahead and do that throughout the whole presentation, and then when we get to that point, we can look at the questions. And you know, if you have a clarifying question or anything at any point, you can unmute yourself. We're just trying to keep it a little organized. And just so you know, we will be recording, so be aware of that. And it's up to you whether you mute yourself or not. So yeah, we can go back to this at the end, but while you're here, Renee, did you want to give a little pitch real quick?
Oh, sure. Yeah, so this blurb is pretty good at describing what I'm trying to do here. So I am working with another healthcare engineer. His name's Aaron. He works and lives in Atlanta. And we're interested in writing an article about, in the IISC magazine, about how we can help healthcare engineers bring more students and engineers into healthcare. It's obviously a very niche field already, and I get the feeling that everyone kind of found their way to healthcare in a very roundabout way, and you know that shouldn't be the case anymore. It should be people reaching out, like people like me and older fellows who can reach out to students and tell them about healthcare and engineering. So I just wanted to interview anyone, if anyone is interested in giving their voice or their opinions, and you can also be anonymous. I would love to be able to interview you and see what your thoughts are. So just email me there, and I can put my email address in the chat as well. Thank you.
All right, thank you. So I'm gonna stop sharing, and well, does anyone have any questions or anything before we start the panel? Okay. All right. So would each of the panelists, would you go ahead and introduce yourselves and introduce your role briefly.
Do you want to organize us, or should we just speak up?
Well, Jordan, go ahead. You spoke up first.
Okay, that's great. It actually, if possible, since there's a good amount, but not too many, it would be interesting to hear who's on the call and where they're from. So I'm Jordan Peck. I'm the VP of Practice Operations for Southern Maine Healthcare, which is a which is part of Maine Health. Maine Health is a 8-hospital system in Maine, based in Portland, Maine. With a large 650-bed academic medical center, some small critical access 25-bed rural hospitals, and Southern Maine Healthcare is the second largest hospital system in Maine Health at 150 beds. With I manage about 30 outpatient clinics, all the specialties you can imagine: pediatrics, primary care, orthopedics, neurology, all that stuff. I just started that in May. I got what I've been calling a field promotion during COVID. But before that, I spent 6 years running our Center for Performance Improvement for the Maine Health Network. So for the full network, I was leading our team of management engineers, Lean Six Sigma people. My background is in engineering. I have a PhD in engineering systems from MIT, where I focused in healthcare design and optimization. And doing lean stuff as well, taking some classes in that. Before that, I got my master's in technology and policy at MIT. And before that, I went to the State University of New York in Binghamton, where I did a bachelor's in physics and a bachelor's in mechanical engineering. And I'm from what people in New York City would call upstate New York, but everyone else just calls around New York City area, suburbs of New York City. And now I live in beautiful Portland, Maine area, which if you haven't been to visit, I highly recommend during the summer.
All right, I guess I can go next then. Hi, everybody. My name is Amelia. I'm currently a senior industrial engineer at the University of Iowa. I'm going to be graduating in December. Right now, I'm interning with the University of Iowa Hospitals and Clinics in their Operations Excellence Department. So we basically are trying to ensure like safety, quality, and efficiency of the processes within the hospital. And then my previous healthcare internship before that was with the Healthcare Systems Engineering Institute, which is out in Boston with Northeastern University. And that was kind of an external consulting position with hospitals around Boston. And then also we did some research within the healthcare systems as well.
All right, I'm Rachel Blanton. I'm currently a master's student studying industrial engineering at the University of Louisville, and I just received my bachelor's in IE as well from there this past year. And I've held 2 healthcare internships as well, one being with Indiana University Health in Indianapolis, working with what they called their transformation team, but basically a performance improvement team. And then this past summer, I worked with Norton Healthcare here in Louisville, working with their clinical engineering department, but helping them to get their ISO certification, as well as doing some process improvement work there too.
Great, thank you. For any of the other students on the line, if you want to, you can briefly say what year you are and what school you go to if you want, so we all know who we're talking to. I'm from the University of Florida, by the way, and I'm a master's / 5th year in industrial engineering.
I'm a junior in industrial and systems engineering at Virginia Tech, and I'm originally from the Chicagoland area.
I'm Christopher. I am a 4th year in studying industrial engineering, going to Northeastern University.
Hey everyone, my name is Matt Levine. I'm a 3rd year industrial engineering major, and I go to Georgia Tech in Atlanta, Georgia.
Hey guys, I'm Siddhant. I'm also a senior in industrial engineering, and I go to Virginia Tech.
I'm Miranda. I'm a junior in industrial engineering, and I go to Binghamton, New York.
Hello guys, I'm Shubham. I'm currently doing my master's in industrial engineering and I'm doing a project in healthcare industry currently. So I'm working in increasing the efficiency for the discharge process. So that's why I was interested in getting to know more about this field and attending the webinar. Thank you.
Awesome. Well, thanks for being here, everyone. So for our panelists, so how do you describe / explain industrial engineering and healthcare for any industrial engineering students who maybe aren't as familiar with that application?
For me personally, it was seeing all of our process improvement tools. I think that's the most basic use of it that most people will see, but also there is a lot of room for like optimization and operations research as well to be applied there.
I usually describe industrial engineering and healthcare as solving problems within the hospital setting to help those who provide direct patient care. So we're applying those industrial engineering methodologies that are traditionally applied in the manufacturing setting just to the healthcare setting instead.
So I used to joke. It frustrated me that I remember in college we had this professor who used to say that they were teaching us engineering thinking. And the great thing about being engineers is that you learn engineering thinking and how that's what makes us different than anyone else. And I just thought that was a bunch of hooey to make us feel good about the fact that our philosophy major friends had half as much homework. But in reality, that's to what Amelia was just saying, it is that ability to do problem solving. And what I find in healthcare in particular, healthcare is obsessed with certifications. And like, you know, if you can't do something unless you got a degree in that thing. And the problem is they overemphasize content knowledge over skill set in terms of problem solving approach. You know, so in reality, what I find with engineers is the ability to solve problems, any kind of problem, without having the content knowledge and just being able to have the tools to break down and understand an issue fundamentally, and then design solutions without any content knowledge about that problem. So it's very handy in that way.
Awesome, thank you. So for the two students, what was maybe your favorite intern project or one that you were most proud of? Or for Jordan, maybe one you've seen from students or one you've done in your own career?
So I had two at IU Health that I both really enjoyed. The first one, I'm proud of it because I got to see the results. I worked in the imaging department and I spent about a month doing time studies with CT scans, which if anyone else has had an internship, you spend a lot of time doing time studies, your first one.
Thank you.
But after that, it was really rewarding to me because the technicians, the whole first month I was there, told me that I was not going to be able to get them their lunch breaks. I was not going to be able to cut the overtime. It's just they have basically crap jobs and nothing I can do is going to help them because I'm just an intern, blah, 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 that. So anyway, I spent the next month doing a lot of analysis and kind of learning how to start doing analysis better. I think I was a sophomore. And anyway, I presented that out to our team and we do a rapid improvement week. So we basically spent a week taking everyone on our team out of their daily operations and we just problem solve for the week and we end up coming up with solutions. So I got to kind of lead that rapid improvement event. And anyway, because it was the first project I worked on, I did get to see the results from it and they did cut all their overtime out and everyone had a lunch. So it was really rewarding to see that even though it wasn't patients I was directly seeing the impact on, I still got to see it on the staff. And for me, that was really nice to know that they did enjoy what I did and that they could also see the rewards of all the tools we use. And then my second project that I worked on was in the operating room. And I just like this one because I got to watch 40 hours of surgery as a sophomore. So that was pretty fun. And the one with that was we were trying to reduce turnaround time. And I don't have the results from it because we implemented the solutions at the end. But it was really neat to get that experience to see as well.
Those are great projects. Okay, so I guess the two projects that I'm most proud of, I'm going to talk about one for my current internship and one for my previous one. So at the University of Iowa Hospital right now, I'm working on a project in the COVID lab. So we currently are trying to increase the efficiency of the COVID processing lab so that we can test more patients. And so we are applying like lean methodologies and workplace analysis to reduce the amount of waste in the process, and hopefully we can improve and increase the number of patients that we are testing. And that's current state right now, so I don't have like the end results of that, but I'm really excited about where it's going. So it's just really fun because COVID obviously has impacted all of our lives so greatly that it's nice to kind of be able to tackle some of the problems that are so relevant to everybody's life right now. And then the project that I am really proud of with the Healthcare Systems Engineering Institute was this project that I worked on where we were developing a simulation model for opioid residency rehab clinics. And basically the state of Massachusetts came to us and told us we have X amount of resources for fighting like the opioid epidemic. How can we best utilize them? So we developed a simulation model that kind of replicated an opioid rehab clinic, and we tried to figure out, okay, is it best to place most of our money in hiring like doctors and physicians and nurse practitioners, or do we need more beds, and how can we allocate the funds to see the greatest improvement or reduction in deaths with the opioid epidemic. So that was really exciting. And I kind of spearheaded that project. It was like my intern project for the summer. So I was really proud of it because I got to make a lot of like the executive decisions. And I also got to see how my coursework was directly applicable because we used a lot of design of experiments and my digital system simulation courses.
Those are great. Those are great internship projects. Yeah, I think one thing you'll find, of course, is the level of project you end up doing is related to the level of sophistication of the people who hire you, right? So there's a lot of people who see engineer and they just think lean, do a process improvement thing. There's a lot of value that an engineer can bring to literally any internship in healthcare. If you think about it, a biology major isn't really learning more about how hospitals work than you are. So there's no reason that they should get, a more clinical internship than you do. And in fact, what they end up using college students for all the time anyway is data entry, time studies, and I've seen interns who came in and worked on a project where they fixed up a database. We have an organ database, donations and things database, and an engineer was able to come in and just clean it up in a way that the director of that organ tissue lab just had no computer skills to do, and it ended up proving really useful and really important. It wasn't using fundamental engineering or industrial engineering tools, but chances are if you've gotten through an engineering degree or even the first couple of years of it, you know how to use Excel or could even program some things on the side. So I've seen that. I did Jim Bennion from Northeastern was on my PhD committee. He's a friend of mine. He was my teacher. Now he's a friend of mine. So we've hosted a lot of Northeastern interns and students who have done some great time study stuff, but also some simulation modeling, looking at improving the admissions from our emergency department using simulations, doing a systems analysis of a resident's day and how they're spending their time to improve the synergy between different activities and improve the actual learning environment based on the systems model, which was cool. I've had an intern who took my dissertation work on forecasting emergency department admissions and applied it at Maine Med. I basically this was very satisfying. I gave him my dissertation and said, go do this here. And, you know, all the code was there. So it was just a matter of getting the data and cleaning it up, but it was cool. We've had interns who modeled our surgical units. So you have an interesting flow where you have your pre-anesthesia or your ACU, your pre-testing, and then you have your actual surgical suite, and then you have your post-anesthesia and all these beds. And what they wanted to do is actually combine the pre and post into one unit, and to maximize the queuing sort of theory, optimize. Because what would happen is all the pre-beds would be full in the morning and the post-beds would be full in the afternoon. And so they said, why don't we combine them? And so they wanted to see if they can save on how many beds, reduce the total number of beds by doing the combination. And so we had an intern do a simulation model using discrete event simulation to show how many beds we would need in this new combined unit. You know, those are the ones that are jumping out of me. I feel old. I've had a lot of interns at this point. And generally speaking, I try to find things that they can do that's really helpful. But I'd say, you know, it's ideal if you really want to do engineering, like if you want to learn a hard engineering tool, you might want to find someone who can be your preceptor who does that engineering. But if you're looking to just get exposure to healthcare, you could probably sell yourself for almost any kind of internship in a hospital. And then you, while you're there, figure out the right way to apply engineering to the problems you're given. Because a lot of hospitals just don't know what to do with us, and we can teach them.
Sounds good. So Amelia, you touched on this briefly, but so what were some of the most helpful classes you guys took? Because I'm sure I always like to hear that this class I'm spending a bunch of time on is not a waste of time. So what's good?
I think definitely the Excel courses we have, and obviously it's going to differ from school, but learning how to use Excel, I can't imagine not using Excel now. So that was definitely the most useful for me. I didn't really use design of experiments in mine, but I could see where that would be really useful as well, depending on your project, like Amelia had said.
I would agree. Excel is crucial to any of the projects I've been working on. So definitely get as many Excel skills as you can. And then I would say like my Six Sigma lean courses, quality control has been really helpful. And then also human factors has also come into play with a lot of my projects at the hospital.
You didn't ask me, but I'll tell you, was something that I wish more of my interns had stronger backgrounds in is statistics. You know, so that comes back to the quality control and Six Sigma. There's so much stuff that people in hospitals make decisions based on really sketchy data, you know, or a really sketchy graph, and a little bit of sophistication around inference from data can make a big difference to the hospital.
So moving on a little, so how and when do you find opportunities in health systems engineering, be that internships or jobs, or, you know, I know a lot of companies start recruiting in like September. Is that a timeline for healthcare, or what do you guys think?
Yeah, for I know for all of our local ones, at least, the healthcare internships for the summer roles start recruiting in September, in October. So it's really early. I would definitely, I don't think anyone here was an undergrad, but networking as soon as you can to meet people in those hospitals, just because they are usually really competitive internships, and knowing someone and having someone know what you do and who you are can help you have a leg up. Also, knowing what role titles to search, that was something I struggled with before getting it. It's not usually ever going to say industrial engineer for a hospital. It'll be, you know, performance improvement, process improvement, operations team, transformation team. So just, I guess, really knowing what to look for and knowing how to pick out those words when you are looking for jobs. That was really helpful once I knew that it wasn't just going to be industrial engineer in a hospital.
I would agree with what Rachel said. Definitely the timeline seems to be like September, October when you should start looking for internships. And I would say the number one thing that actually helped me was going onto LinkedIn. And if you know like kind of some of the like key search terms that Rachel was talking about, you can actually subscribe to like job descriptions that look similar to that. And then LinkedIn will send you emails when jobs come up that are similar to that description, because sometimes when you like go onto Google, there might not be anything available at that exact time that you're searching. But then, you know, like a week or two later, you'll get an email from LinkedIn saying, hey, there's a job that has like a similar description to this. Are you interested in applying? And I found a lot of different opportunities through that method.
I used that too. It was super helpful.
Maine Health has an internship program, similar timeline.
But I agree.
Similar timeline, September, October. We might be a little bit later, maybe it's into December. And similar idea, actually what we have is, the way we do it is we have a general internship program and you apply and you can say what department you want, but otherwise they just look for a good fit. So we've had engineers who applied and we had already picked an engineer, but I would reach out to someone else and say, hey, I saw this resume, you might want to hire an engineer. I know, maybe your project is data-based or something and you might find value in that. The other thing about hospitals, and this depends on how committed you are to that career path, is they all take volunteers, right? So hospitals, it's a very close-knit community. Everybody knows everybody. People reach out. I mean, I get random directors or whatever reach out to me and say, hey, my kid wants to do an internship, or I know someone who, and that might be a Maine thing, but I'm guessing it's everywhere. So if you volunteer and you just get to know a problem, regardless of whether you're using engineering or not, it's a great way to get your foot in the door, even if you just do it for a couple of months. And then you can network your way to a job.
Yeah, agreed with that. And also be persistent. If healthcare is something you're passionate about, it is kind of a hard field to get into as an engineer. So just be persistent. My internship at IU Health, we have to have 3 co-ops for U of L. And my first one was with an automotive manufacturer. And I hated it, and I hated the automotive industry, and I knew I wanted to get into healthcare. So I did not sign up for a second one with that company, and instead it was past the deadline of when our local hospital was taking an intern. So I called every hospital in the surrounding metro area of Louisville, the tri-states, and literally just kept asking the operator if they had internships until I found one. And that actually, I think, is what got me my role, because when the lady who was interviewing me heard that, she was like, oh, you definitely are persistent enough to want to be in this position. So just if it's something you really want and you're passionate about, just don't be afraid to reach out to anyone either.
And if you're willing to work for free, we can usually make an internship happen.
True. It's a lot easier that way. Both for them. Not
everyone has that level of privilege, but if you do,
yeah.
Use it.
So it is 6:30 and I saw we got an audience question. So I'll go ahead and ask it. But Shubham asked, he said he's been using Power BI a lot in his current project. And what are some tools and software which are handy while working on health systems projects?
I'll jump in first. Power BI is really cool. Power BI, Tableau, and Qlik, which I think is spelled QLIK, are all really useful tools that are getting popular right now. Like I think it was Rachel that said Excel is just like you know, when you show people how to make a pivot chart, or, you know, if you show them how to do Visual Basic, you've just blown their reality. Like they didn't realize that that was even something Excel could do. So, you know, a lot of the problems we can solve can be solved with just basic Excel tools. You know, the other thing that I'm finding, hospitals are cheap. We don't have a lot of money. We're getting squeezed by insurance companies, and the prices of drugs and you know, healthcare devices are going up. So not a ton of money there, even for the ones that make some good money, relatively speaking. So when doing statistics, R is very popular, right? So just being able to download R and do all your modeling and even some programming for free. So I'd recommend boning up on R.
Another software that I use a lot in my internship right now is Visio and Process Simulator. Process Simulator is like the simulation software that attaches to Visio, but we use Visio a lot for our process mapping. I would say almost every project we use has Visio. It's definitely not cheap, but it is a Microsoft project or software, so I would definitely look into getting some experience with that.
Yeah, I was going to say Visio as well. We definitely use that a lot. And then going back to the statistics, I think Jordan mentioned earlier, knowing how to use Minitab has been really helpful as well.
Cool. If anyone else has a question from the audience, feel free to put it in the chat. But for now, I'll ask, so how do you frame your experience in education on your application / what do you look for when applying, especially if you don't have a ton of experience?
I can go first. So I would say if you don't have a ton of experience, the way that I like first started out with like expressing my interest in healthcare is by tailoring my focus area. I'm not sure if like all colleges have this option, but for us, like industrial engineers have to take a certain number of electives, and the focus area options are like human factors, management, or you can do like a tailored option. So I tailored mine for health systems engineering, and so I took courses that were applicable to that. And then I would say when you're reading the job description, look for those like specific qualities or characteristics that they're looking for, and try to come up with course projects that you've worked on that are similar, and try to show how they're applicable to the healthcare setting.
Yeah, I think Amelia just nailed it. You really want to, anytime you're applying for anything, take that extra time and tailor your resume to that thing. You know, it's always worth, you're better off only applying for 5 jobs that you've tailored your resume to than just throwing your resume out to 20 different jobs. So, you know, look at the project, think about the skill set. If you're applying for a more generalized internship, you might want to focus on your you know, have more about your volunteer activities and specific skill sets, versus if it's an engineering project, you know, showing the or engineering internship, the different projects you've done and things like that. So you definitely want to read those job descriptions. If you have a contact that you can find on LinkedIn, talk to someone, find what they're looking for, and tailor your resume that way.
It looks like Shubham has a question. Shubham, do you want to just say it, or I don't know if you're typing it. Oh, here we go. He says it's hard to specifically search for internships, full-time jobs in healthcare field on LinkedIn. Are there any, well, that was his question, but are there any like maybe keywords that you specifically look for or search for?
So the SHS website actually has a pre-filtered job search that you can use. I forget what software uses, but that's a helpful one for sure. You know, the other thing I'd say, and you know, this depends on your personal life situation. If you are dedicated to a certain region or geographic area, there's only so many hospitals. So just go to their website directly and search for them. Like Rachel was saying, just calling around and there's only so many hospitals in an area and driving distance if you're limited to that. If you're willing to work anywhere in the country, then start with the cities you want to go to, Portland, Maine, and then see if they have any jobs on their hospital websites. LinkedIn is easy, it collects it all, but there's not that many hospitals, and if you're really dedicated to doing it, you could probably find one on their website.
I agree. Those are great recommendations. If you're looking for like a specific keyword, honestly, the one that's gotten me the best results is just healthcare systems engineer. Usually if you have the word healthcare somewhere in there and systems in there, that kind of implies industrial engineering. So that's one that I use the most frequently, but I agree it is definitely hard to kind of know what those key search words should be.
We've had engineers hire as improvement specialists. That's a popular one. Analysts. I mean, if you're looking to do more of the data side, finding an analyst job is good. Trying to think what else we've hired. Access specialists actually is sometimes something hospitals use.
I've seen the word coordinator a lot too, either improvement coordinator or like transformation coordinator, whatever their like department is called, coordinator. I've seen that quite a bit.
That's a good one.
So another one of our questions. So how can you be sure to get the most out of your internship? I think a lot of times people do their internships, maybe not in healthcare, but other places, and it's not always what they thought it was going to be. How can you avoid that?
Ask up, tell people what you're looking for up front. Don't be afraid to speak up if there's something you want to learn. I've never heard of an internship where they're not willing to help you learn something. They want to gain something out of you being there as well as you want to gain something. So just be very vocal about what you're wanting to learn and to get experience in, and most people will be willing to help you.
I'd agree with that. Definitely speak up if there's like a project that you're interested in. Just ask if there's like anything that you can do to help support that project. This is slightly off topic, but the best advice that someone gave me during my first internship, is to write down the projects that you're working on, what the problem statement was, what methods you used to solve it, and what results you got out of it. Because you're going to be in future interviews or future applications in the future, and they're going to ask you about, like, tell me about a time when you used this method, or tell me about a time when you solved a problem and you had to work with a team. And being able to like pull out those specific like project details, especially if the internship was 2 or 3 years ago, sometimes it's like you're starting to scratch your head and you're like, oh, what were the specific details of that project? Especially if you work on multiple projects throughout like an internship or a co-op. So I've definitely been good about like logging the different projects I've been working on, and I always pull it out whenever I'm applying to a job or preparing for an interview.
Good advice. There's the textbook advice that I can tell you. You want to be purposeful about the internship you've got. What are you trying to go in there to do? You're trying to narrow down what field you want to work in. You're trying to apply a tool that you want more experience in. You're looking to network. If I'm being honest with you, I didn't do any of that. My first internship, I was a mechanical engineer in Binghamton, and I got an internship at the National Institute of Standards and Technology, and I just thought it was cool that I'd live in DC, and I do some fun research, and I had a great summer, hung out with other young people, and realized I didn't want to do mechanical engineering research. So I didn't go in there with a purpose, but I certainly ended up learning something from the internship. And then I did the same internship again the next summer because I just really enjoyed being down in DC for the summer. And then I got, but what it taught me is I wanted to work in a more human-based area, and that helped me decide what master's degree I went after, and then that led me down the healthcare track. So I'd say don't, there's a lot of opportunity out there, but I also wouldn't say like, don't just sit around and wait for that perfect opportunity. Like look for one that looks good and go for it. If it checks enough of your boxes, you'll learn something. And then I think like Rachel said, you bring a lot with you to it, right? Go reach out to the person who's hired you and say, I could really use some time. I'd love to go observe. The interns are very cheap, or at least almost free. So if you say, hey, can I go spend some time in the OR? No one's going to stop you, even if it's not your project. So you could always, while you're there, try to make more out of it.
Any other audience questions?
I have a question that kind of relates to that, actually. This past summer, I worked in DC as well as a mechanical engineer for an HVAC consulting firm, actually. But I do have contacts in the distribution of like hemostasis, chemistry, urinalysis, imaging world, but I do have an interest in like the healthcare systems. Do you think it would be like a good segue if I was able to get in that industry into, maybe like a second or third job like further down the road in healthcare if I have a background in, more of the like manufacturing distribution of like point of care items like that?
So there's a lot of jobs in supply chain, of course. Large healthcare systems have big supply chain networks. And so if you're interested in that, you could always segue in that way. I mean, people come to healthcare performance improvement from all sorts of different sectors. I mean, and both Amelia and Rachel, mentioned this, the lean stuff. I mean, lean is lean. There's a little bit more human factors, like Amelia mentioned, in healthcare than you might experience elsewhere. But if you're getting some experience with tools, so you're learning Excel, Visio, statistics, programming, that's all useful. You're picking up some healthcare lingo, the acronyms, and a little bit about care models and things like that, payment models. That's all helpful. And then, you could find sometimes jobs. It's hard. It's hard to make a transition to like a healthcare operations job. So it's hard to go from like working at a supplier to then want to go run a practice.
Right.
But if you were looking to transition to like an improvement shop or where you do lean projects or teach lean, it would work. So the question comes down to what you were saying is, how far down the road do you want to go, right? So if you're working for a supplier or some healthcare related company, and you end up on the director level, it's going to be hard to get another director level job at a hospital.
Right.
Unless it's in performance improvement or supply chain or something like that. So if you're looking to get into healthcare and the pure healthcare operations, like if you want to run a hospital one day, you have to, make sure you transition at the right time so you don't have to take a step back. And many people do. I've had friends who got pretty far and just decided their soul wasn't in it. And so they took a cut to get into healthcare. So you can do it, but, I wouldn't recommend it. If you
okay. Thank you.
I guess I have a question. So in light of this global pandemic, any theories on how that will shape internships for next year or the job market? I know some got canceled last summer, so any ideas?
I think it hurts initially right now, definitely, for anyone trying to get an internship and a job. There are less because of the pandemic and because hospitals have had to, make layoffs or cuts or to cut internship programs. But honestly, in the long run of this, I think it'll make healthcare organizations realize the need for engineers in their health systems, especially, the supply chain aspect in general. That was a huge part of the beginning of the pandemic, was not having enough PPE for anyone. I know a lot of my friends that work in healthcare, those were the projects they were put on immediately, no matter what they were doing. So I think that's one example, but I think the need for engineers in healthcare is actually going to be bigger after this. So like I said, not initially, but later on, I think it'll be good for us.
Now's the time to volunteer. The majority of the hospital volunteers are retirees, and all of them are at increased risk of COVID. And so our biggest pool of volunteers isn't coming in anymore, and we're struggling with that. And so this is a chance, this winter, obviously it's hard to volunteer while you're in classes and everything, but if you have a good winter break and you can volunteer for a month or two, then network, and then you can secure an internship after, in the summer. So we might not post the internships because we're not going to, want to figure out how to do remote internships and stuff. But if you show that you're someone who's willing to come in during COVID and get some work done and someone they can rely on, you could probably get an internship designed for you.
I have a follow-up question
Great
to
point
that.
as well. This is just a hypothesis, but I have a feeling that maybe some of the internships this coming summer will be
Did we lose you, Amelia? Well, Matt, I think you can ask your question.
All right. Yeah, I had a follow-up question to what you just spoke on, Jordan. If I were to reach out to a hospital as far as a volunteering opportunity, is there a certain area of the hospital that would be worth asking to volunteer in to get the best feel of how process improvement could relate to healthcare?
Well, the great thing about, so that there's always stuff we have for the volunteers to do, and I'd say you can work literally anywhere and learn something about the way the hospital works. Even, I volunteered at a hospital cafeteria for a few months, just watching, listening to the conversation, talking to docs. That said, most volunteer offices have connections everywhere. I'll bet if you, and most volunteer offices, most hospitals have performance improvement groups. So if you say, can I volunteer in the quality department, or can I volunteer in the performance improvement department, they might not normally have volunteers, but people very rarely turn down free labor, especially if you bring some skill with you. So most hospitals have like a volunteer coordinator, at least the large hospitals. And so you just talk, you just talk to that person. What are you interested in, and see where you go. So again, I'd say you could go anywhere, but if you're gonna try to make like the most of it, ask if you can volunteer in quality, performance improvement, supply chain. Those three are the way to go.
Thank you.
Amelia?
Or operations. Some of them have a straight operations department, like practice ops or something like that.
Mm-hmm.
I'll take a volunteer.
Amelia, did you want to finish your hypothesis? I think we heard you have a hypothesis.
Sorry about that. Sometimes I live in an apartment building, so when everybody comes home and starts doing their homework around 6 p.m., our internet becomes like less stable. But anyways, my hypothesis is that the internships this summer are going to be primarily online, and so a lot of the projects are going to be more data analysis based, because they don't have to like introduce you to the team and like bring you into the hospital. With a lot of like the COVID restrictions and stuff, they're trying to minimize the number of students that are on campus. At least that's what I've been seeing with the University of Iowa Hospital. So I would definitely like prepare to put those Excel data analysis skills to the test this coming summer.
Sure. Yeah. All right. Any other questions for our panelists, or panelists? Anything else we didn't hit that you're like, these students need to know this? All right. Well, I think I'll call it then. Thanks for coming, everyone. Don't forget, if you're not on the LinkedIn page, that's a great resource and a great way to stay connected and come to whatever other events we have. So, all Yeah, and then there's the LinkedIn page.
I'm on LinkedIn. Feel free to find me. I'm happy to connect and answer any questions.
Yep, same here. Ditto that. Thanks.
I found in general, a lot of people in Society for Health Systems are always happy to connect with whoever. So
It's literally why the organization exists. It's a networking organization. So if we're members, we're there for a reason.
all right. Well, everyone have a great night and stay safe. And yep. See you all.
Thank you.
Thank you.